World Malaria Day, that is marked every 25th of April, highlights the global efforts to control malaria and celebrating the gains that have been made. The good news is since 2000, the world has made historic progress against malaria, saving millions of lives. However, half of the world still lives at risk from this preventable, treatable disease, which costs a child's life every 2 minutes. The world today marks International Malaria Day amidst a global COVID-19 pandemic, and the World Health Organization fears that progress against malaria has stalled. This evening, we are joined by the team leader of Tropical and Vector-Borne Disease Program at WHO Africa, Dr. Akpaka Kalu, via Skype. Thank you for taking your time to speak to us this evening, Dr. Kalu.
Be here.
Now, as we mark International Malaria Day today, are you seeing any challenges in balancing COVID-19 control and malaria control in any countries? And if so, what resources is the WHO providing to help these countries balance these two agendas to implement appropriate public health measures?
Certainly there are challenges. Countries have focused on controlling COVID, on shutting down countries, and within countries, shutting down parts of the country. While those are good intentions and are good interventions aimed at reducing transmission, improving social distancing, but it has the impact, the negative impact that we may not anticipate. Because when you shut down and ask people to stay home, health workers are also staying at home. Where you do not make appropriate arrangements for transportation of health workers who are allowed to go to work, they will not be able to get to the health facility to provide service. Also, there will be no transportation for people who are sick of malaria, especially children and pregnant women, to get to the health center to be able to get their services. So those are the unintended challenges that may arise from the response to the COVID pandemic. And WHO from day one is saying, keep the routine health services open. Continue supporting delivery of routine health services, including malaria interventions. And WHO has, of course, provided guidance on how to tailor malaria interventions in the context of COVID response. And the anchor of that is protection of health workers. Health workers should not be infected by COVID. They should be given appropriate protection, ensuring that be it community health workers or workers at primary health care level or tertiary level remain and are available to provide services, ensuring that the commodities are available, ensuring that planned preventive interventions like distribution of nets continue even during the COVID response. Because unless we do that, we are cutting disaster at the end of the year. The WHO modeling was also part of trying to look at what is the potential impact based on 9 scenarios. And we have found that more than 700,000 deaths will occur in Africa, sub-Saharan Africa, if we do not ensure that malaria services are kept open and are delivered to those that need them.
Dr. Akpaka, we know that WHO global malaria programs are piloting studies of the RTS malaria vaccine, especially in sub-Saharan Africa. How might the COVID-19 pandemic affect this?
First, we'd like to congratulate the governments of Ghana, Malawi, and Kenya for continuing the pilot even when they are responding to the COVID. That pilot is still going on even now, but the potential for that to be affected is there. If service delivery is shut down, then the children who are targets of this pilot will not get to the facility to get vaccinated, and therefore the pilot will suffer. So it boils down to keeping routine health services open, keeping immunization services open, keeping delivery of malaria services at the health facilities open. When we do this, the piloting will not suffer, and we'll get to make a decision as an organization on what is the appropriate policy to adopt. If it's to scale up, if it goes all well in the whole of Africa, we will do it. The vaccine is a welcome addition to the arsenal available to the malaria community to deploy in defeating malaria.
So we've also seen that malaria drugs such as chloroquine and hydroxychloroquine have been suggested for treating COVID-19. What are the implications of this? Does this mean that patients being treated for malaria with these drugs are resistant to COVID-19?
Well, in Africa, for the last 10 or more years, we no longer use chloroquine generally as first-line treatment for malaria. Therefore, even if chloroquine was used for any other purpose, do not affect our malaria control in Africa. But at this point in time, it is still a subject of research. WHO has not approved the use of any of these medicines for treatment of COVID. There is research going on. When the reports come out, to be reviewed by experts, and then recommendations will be made.
Dr. Kalu, how do these compounded threats impact certain at-risk populations, like you said, children or pregnant women or the elderly, and what public health measures might be taken to mitigate this?
The population segments you've mentioned, children, pregnant women, and the elderly, they have one thing in common. Their capacity to cope with infections are relatively lower, so-called reduced immunity. And therefore, yes, they are at risk of contracting COVID infection, that's true. They are also at risk of malaria because of, especially children and pregnant women, because of their reduced immunity. But that is why we are saying keep the malaria services open. The routine distribution of nets to pregnant women, the routine treatment of women at the antenatal facilities when they visit, giving them directly observed treatment with the IPTP should continue. For children where it's policy, the routine treatment should continue, routine preventive treatment with SP should also continue. That is the only one. And then, of course, both pregnant women and children should sleep under insecticide-treated nets. That is the way to protect them. That is the way to ensure that even as we respond to COVID, their health is not compromised.
Before I let you go, Dr. Kalu, the World Health Organization is running a campaign called Zero Malaria. Starts with me. What do you hope to see with this campaign?
It's about personal responsibility. I believe I'm personally responsible for ensuring that members of my household and indeed members of my community protect themselves from malaria, starting with me. And I believe, therefore, that if any person near me suffers malaria, then I should be questioning myself and my commitment. I should also be questioning myself if people are dying from malaria. Indeed, malaria is preventable. Therefore, every single death from malaria is preventable. And for somebody in Africa in 2020 to die from a preventable disease, for me, it's unpardonable. So zero malaria starts with me is real. It's about accountability. Have I accounted today? What have I done to ensure that the neighbor, my next neighbor, does not suffer from malaria? If I notice that their child does not have a net to sleep in, I should be able to do something. And thankfully, the nets are relatively free in most countries. Where it's not free, it's available in the commercial sector. You can pick it up, and it's cheap. So it's about it's about accountability, it's about commitment to ridding Africa of malaria.
Many thanks for joining us for tonight, Dr. Akpaka.
Thank you very much. My pleasure.
All right.